Hello, it's Judith here with this week's video, and it is number 3 in the series of 6 videos covering the 6 main symptoms of anxiety. And this week we're going to talk about a nasty, tricky little symptom, and that is poor sleep. Most of the people I see with anxiety have some kind of sleep problem. And sometimes having a sleep problem actually causes anxiety. So it works in both ways. So, if I have somebody who's not slept properly for years sometimes, that often leads to anxiety, particularly anxiety about sleep. So what's going on with this one? Generally, it's to do with a very busy mind. So typically people with anxiety will talk about the fact that, their mind is constantly on the go, one thing after another, over and over again, described in all sorts of ways, but it is just constant chatter inside your head, some of it often unpleasant, and we'll talk about that in another video. So your mind is in overwhelm. It is just dotting about, thinking of this, thinking of that, thinking of the other, and it's not just the sort of busy thinking. It is sort of repetitive and appears totally out of your control. What that means is 2 things related to sleep. Either your mind is so busy that you can't switch it off, so you can't get to sleep in the first place, or managing your anxiety on a daily basis, which most people are doing before they come and see me, is exhausting. So they go to bed, they go to sleep very quickly. It's poor sleep because of their anxiety, and it doesn't last. So it's what I call the 3 a.m. hamster wheel. They wake up at some time in the early hours and it's just going on. Literally like a hamster on a wheel. Your brain is whirring round and round and round and round, thinking of more things to think about. And we all do this on occasions, and whenever I do it, it amazes me in the morning. I'm really worried about that in the middle of the, it's often, sometimes it isn't, but it is often something absolutely trivial that's just going round and round and round and round. Sometimes, as I say, it's much worse and you're into the catastrophization, what's the worst that could happen? What if this happens? What if that happens? And depending on what's going on in your life, it could be financial, it could be relationship related, it could be work related, but you're always seeing the worst possible outcome. So anxiety is tricky because it can be a cause of poor sleep or be caused by poor sleep. So sleep is the tricky one, really. And also, not sleeping is inevitably going to make your anxiety worse. We need sleep. We need 5 90-minute cycles of sleep. And the important bits of each cycle are at the end. The rapid eye movement sleep, which is when we dream and do cell renewal and do all sorts of other vital things. And if we're not getting to that, not getting 5 cycles, then we're going to be struggling during the day. It's not just that you're tired, and that's bad enough. It's you're physically affected, your immune system will be low, your digestive system may be affected, your resilience is affected. You just find it harder to cope with things that you could cope with normally. And that just means that makes your anxiety worse. So anxiety stops you from sleeping, and stopping you from sleeping makes your anxiety worse. So you are in a little downward spiral, and it's almost impossible to break out of that without some kind of intervention. So if this describes you or somebody you know, then 2 options, well, 3 options. 1, you can talk to me, and possibly, option number 2, come and see me for some help with your sleep. Or there will be a link to the page on my website where there is another video to deal with one of the symptoms, and there is one there for sleep. So you can start with that and see how it goes, and then if it works, wonderful, I'm delighted. And if you think you need more help, you know where I am. And hypnotherapy is very, very helpful with sleep. So I use recordings and I use self-hypnosis to help people manage their sleep a lot better. And managing the sleep can often have a fairly quick and huge impact on their levels of anxiety. So it's really, really worth tackling this one. Okay, then, that's it for this week. I look forward to seeing you next week when we'll be doing another symptom. And until then, take care of yourself. Bye.